Thank you for joining us at Jones Advisory Group's training room. This is a virtual Medicare educational workshop with Josh Wyatt. I'm so glad you're joining us today and visiting us today through this virtual webinar. So I'm excited to present this material to you. It's all about Medicare 101 Foundation, so we're going to go over this information. I can email this slide to you, but ultimately sit back, relax, let's learn a little bit about Medicare. Alrighty. So, quick disclosures. Want to let you know that I am a licensed financial advisor with a fiduciary standard here in Kansas. Also, I am licensed on the health and life insurance side in Kansas and Missouri. I do want to give disclosures that I am not employed by Medicare or the federal government directly. So just quick little disclosures there. Great. Our agenda is just 5 simple things today. First, we're going to talk about the Medicare Basics. We're going to talk about Medicare supplements, Medicare Advantage plans, also prescription drugs plans called Part D, and then we're going to talk a little bit about important dates. Because one of the biggest questions that I usually get as the Medicare man here in Kansas is, Josh, when do I sign up? When's the best time? And so we'll go over that today through this 101 course. Now, this is a 2-part series. So step number 1, let's raise your foundation, right? So let's go ahead and start a good foundation of Medicare 101. And the second session part is really kind of dive into your situation. Are we continuing to work after 65? What's the best timing? What's the cost? What's the options? And then we come up with a great game plan here at Jones Advisory Group. All right, let's dive in. Okay, looking at healthcare cost and retirement can be very expensive. Looking at our past, looking at the trend, overall in 2019 we spent about $3.8 trillion on healthcare. Huge number. We need to plan for these additional increases in healthcare costs. Next, projection. The next 20 years, it's projected to increase 5.4% over the next 20 years. That's greater than inflation, so we need to plan for that. Part of our retirement planning process is we want to make sure that we plan for the unexpected healthcare cost. Alrighty. Next, let's look at a graph here. So healthcare costs have a dramatic impact on your retirement. If we look at these 3 charts here, or this one chart, 3 different graphs. So we're looking at overall inflation, roughly about 45% over the last 20 years. As we look at earnings for workers, that's about 60% or so. But look at the big number here, the elephant in the room. We're looking at healthcare insurance costs, about 255% in the last 20 years that has increased, just in premiums alone. So huge costs that we need to plan for in the future. Next, let's talk about senior spending in healthcare. So as we look at the overall budget, in the past, overall budget, if we look on this here, is about 8.2% overall, all ages. But as we get older in retirement time frame, we call it the retirement end zone, we're looking at closer to 13.6% of our budget goes towards healthcare costs. So again, we need to plan for those additional expenses. Now, what is Medicare? Well, Medicare is a federal program that covers over 61 million Americans. Gosh, 10,000 people turn 65 every day, so it does increase. But really there's 3 parts. So there's 3 parts to Medicare. We're looking at original Medicare, which is Part A and B. Then we look at Part C, which is also called Medicare Advantage Plan. And then we look at Part D plan. So Part D is prescription drug coverage. Different parts here, we're going to help navigate that today. So we make the Medicare maze easy. All right, so again, original Medicare is offered by the federal government. So you have Part A, so we have the hospital coverage, skilled nursing, hospice care, and home health care. That's covered under Part A on Medicare. Now, Part B, it will cover also doctor's appointments, durable medical equipment. We're looking at outpatient care and occupational and physical therapy. So think of it when I go to the doctor, it covers Part B. And just a side note, even COVID vaccines are covered under the Part D, the Part B hospital doctor's coverage. Okay, we'll edit all that later. All right, here we go. Now, Medicare coverage. Looking at Part C and D, that is offered by private insurance companies. And so that's important to note. private insurance companies run these programs, and we'll kind of talk a little bit about what that means. Now, Part C, as in CAT, covers Medicare Advantage plans. So think of it as it mirrors A and B coverage, but it might include dental, vision, hearing, and maybe silver sneakers, some wellness programs out there. So there's some advantages to a Medicare Advantage plan. Imagine that. Now, Part D plan also covers prescription drug coverage. So as we look at prescription drugs, that's going to be a separate component to cover prescriptions like at the pharmacy. It may also include vaccines or flu shots if you get them at the pharmacy and other coverages there. So we'll dive into that in a little bit. All right. So originally Medicare was designed to cover, like Social Security, it was never designed to cover 100% of your healthcare costs. It is really designed to cover a majority of it, maybe 80%, but the rest you have to pay. So there's a copay here. So we'll dive into that next. But I want to pause for a moment. I want to focus on this, it's important. A lot of people have a lot of questions, depending on your earnings, that your Medicare premiums could actually change. It could change based on your income. So for most of the time, here on this screen, most people pay about $148.50 for Part B coverage. If you earn more money, for instance, I got a severance from work, you might jump on this grid here. So there's a grid over here that talks about, hey, if I earn more, I pay more. Good news is we have some strategies here that if you do earn more, it looks back 2 years, and there's also a form out there called the SSA-44 form. I can talk a little bit more through that, but basically it says, hey, I earned this amount of money when I retired back 2 years ago, but now that I'm on Medicare, my earnings have maybe changed. And so there's a process to reach out to Medicare and Social Security office to get an exception where you might possibly go back to a lower tier opposed to the higher tier. So what this is telling us, hey, most people pay $148, but you might be able to, if you're a higher earnings, you could potentially pay as much as $504 a month per person if you have higher earnings. So we can have that conversation on the sideline, okay? Great. Now let's talk about original Medicare. So first we're going to focus on Part A. If you've worked for over 10 years or 40 quarters and paid into the program, for most people it's $0. However, there is a deductible of roughly $14.84 per period. So we'll focus on that. There is a deductible there. If you go into the hospital, there's a $14.84 deductible per period. Now, looking at additional coverages, if you went to the hospital the first 60 days, you pay nothing. After 60 days, you pay $371, and then after 150 days, Medicare pays 100%. So you're covered there. Well, Josh, what about skilled nursing? Same kind of schedule. First 20 days, you pay zero, nothing. And then after that, you pay a little bit until per day, a certain amount per day, up to 100 days. And then after 100 days, Medicare pays 100%, completely covered. Now that we have Part A as the hospital, let's focus on Part B, as in doctor's visits. So the doctor's visits, we have your monthly premium of $148 for most. Remember that slide before this? If you earn more, there's a grid, you could potentially pay up to $504 based on your IRS filings 2 years prior. Again, we can have that conversation on the sideline. It's very easy. We'll help kind of plan for that. Now, deductible for Part B is going up just a little bit every year. It's about $203 for 2021. Now, Medicare pays 80% of that doctor's bill, but then right here is 20%. That's really the elephant in the room. I want to talk about that for a moment. That is uncapped. So if you went to the doctor's office, had a major surgery, major operation, potentially could have a $50,000 bill, you would have $50,000 billing, if you will. You could potentially have a copay of $10,000. So we want to plan for that. There are options to help cover that. But again, this 20% copay for Part B coverage is uncapped. There is no limit. Okay, you got it. Now, let's talk a little bit about the average. So looking at the average, Medicare gives us an estimate here. There's a little link here that talks about, okay, so what does the average person spend for Medicare and extra coverages? All right, so Part B, now these are last year's numbers, well, 2019's numbers, $135.50 per month for Part B. Then you have inpatient care, about $38 on average. Prescription drugs, some people have zero prescriptions, some people have a lot. And so on average, the average person spends roughly about $320 a month. Shocking for some, what a deal for others. So we'll see. Now dental service is about $42, and then other healthcare services $111. So total cost is about $654 a month and change for the average person who's on Medicare and the cost. Now, we want to obviously find ways, solutions that we can help cover those costs. And here you go. This is a fork in the road. I use the driving analogy as, hey, we're going to a street, I have a fork in the road, I have to drive left or I have to drive right. I don't have both options. So the same way with Medicare, you have to choose either original Medicare or you have to choose Part C, which is Medicare Advantage Plan. You can't have both, okay? So let's talk about that. On the left side, if you choose original Medicare, which is Part A and Part B, you may enroll in a Medicare supplement, which we'll talk about next, and then a standalone Part D, prescription drug coverage. That, I would say, is 60% of Americans sign up on that kind of plan. Now, the other option, the right side of the fork in the road, is a Medicare Advantage plan. Think of Part C. Now, Part C, again, mirrors Part A and B. You might also get prescription drug coverage, and then you might get dental, vision, and hearing. But also, you might get a Silver Sneakers program or a wellness program, as an example. So often you pay lower cost for a Medicare Advantage plan and then have a high deductible. So think of it as this way. On the left side, you pay me now. I pay monthly premiums to cover this side, original Medicare with a supplement, or pay me later, which is I don't pay anything or very low monthly cost here, but then down the road I potentially could have a large deductible. So we'll kind of explore both of those options. But remember, left to right, I got two options. I can't choose both. All right? Got it? Good. All right, so let's dive into why does it make sense to get that additional coverage? And we'll look at that. Great. So what is a Medicare supplement? All right, so the Medicare supplement actually covers co-pays, co-insurance, and yearly deductibles. It's great. It's actually administered through private insurance companies, and it's going to cover the additional gap. You might hear the term Medicare supplement or Medigap. They're very interchangeable, same term. So we'll dive into and see exactly what does that mean to you. Great. Gosh, with the Medicare supplement options, you have a lot of choices here. You have actually Plan A through Plan N, and if you're on Plan F right now, you're grandfathered in. So there's a lot of different plans that are available. The beauty of this is it's standardized. Medicare did a great job here comparing apples to apples. So if you go with the Plan G as an example, with a certain company, call it the blue company, or the red company, or the purple company, it's exactly the same thing. The only difference is what are they charging premium, and what's my level of customer service. But otherwise, it's going to walk, talk, and act just the same way. It is standardized product, which is great. So we're going to make it simple for you. A lot of options here, but let's make it simpler. Again, we want to navigate the Medicare maze. So we're going to focus on Plan G and Plan N for today, on the supplement world. Well, everyone says, Josh, what's the Cadillac plan? Easy answer. Plan G is the Cadillac plan. What does that include? It's going to cover your Part A deductible at 100%. It's basically going to cover all your different deductibles that we just went over except for one. You pay a $203 check to the doctor's office, and then the rest of the bills will be covered by Medicare, right? The 80%, and then the other piece would be covered on the doctor's side. So very nice coverage there. The only difference with Plan N and Plan G is something called excess charges. So a lot of people say, well, Josh, what's excess charges? Basically what that means is the doctor can charge up to 15% over what Medicare approves. So that's something that we definitely want to cover, and that's why Plan G is the most comprehensive option available today. Great. Now, let's go back to that chart. We're going to see how Plan G is in action. That's important to see it. So my daughter likes to play this game where you slice fruit in the air, and I feel like a commercial. But you can see here, boom, we're slicing that $14.84, slice it, meaning Plan G covers that. We're also going to take care of the other coverages. The hospital co-pays are going to be covered by a Plan G. Then we have skilled nursing. We even have that 20% copay. Remember this number, this big number that we don't know, there's no cap? That's going to be also picked up by a supplement. remember, the only thing that you pay with the Plan G is $203 per year. And so that's amazing. So it's going to cover a lot of coverage there with a monthly premium, etc. So let's look at the numbers in action. Great. So as we look at the numbers in action, we're going to take a 65-year-old male coverage. Remember, he's going to have all the expenses covered except for the $203 Part B deductible. We're also going to look at the Part A deductible, that 20% copay, that 15% excess charges, that, again, doctor can charge over 15% of what Medicare allows, but then they have to write off the rest. And then looking at the other copay. So now the total out-of-pocket expense on average goes from that $655 number to $268 on average for that number. So very powerful solution to help cover those healthcare costs. Now, what it is to help to avoid unexpected expenses. And that's why a supplement is very important for you to look as an option. Alrighty. Now, Medicare Advantage Plan. Let's look at that. How does that help? How does that work? Okay. So now we look at a Medicare Advantage Plan. Now this is different. So this isn't like a Plan G or a supplement policy. They're not all apples to apples. This is more in the world of apples, oranges, and pears. So every different company has different benefits. Now, it's supposed to mirror Part A and B. So you're going to get very similar coverages on the hospital and doctors. But it is administered by private insurance companies. And so think of it as more like a PPO plan where you have healthcare provider networks, you have different deductibles, you have different features and stuff. So they're a little bit trickier to compare, but don't worry, I make it easy for you. I know the plans in our area. We'll just sit down and see what your needs are, and we just match them together to make sure it's a good fit. Great. So you might have copays that are taken care of, and there's a different network of doctors and hospitals. So there are some really great advantages of a Medicare Advantage plan, but we want to make sure it's a right fit for you. We'll explore that. Great. So again, visual aid here. We're looking at option 2, the right side of the fork in the road. We have Part C, which mirrors Part A and B, and then you might have a prescription drug plan included, plus additional services. So that's something that we can explore together. Great. Now, here's a comparison. I like the A and B comparison, so we'll kind of go through this briefly. Number 1, monthly premium. So yes, Medicare supplements, they have a monthly premium, so it depends on your area, depends on your age, your gender. There's a few factors there. Everyone pays a different price based on a few factors. Medicare Advantage plan typically is $0 to either a very low, under $50 a month. Now, when we look at Part D and dental and vision, with the Medicare Advantage plan, you just sign up on your individual policies. Very simple. We can help with that. Now, with the Medicare Advantage plan, they may also include it baked into the plan. Now, copays and providers, the supplement copays to providers, no, we don't have coverage there, but they also have yes there. But here's the big one here. With the Medicare Advantage with separate pay me now, pay me later, you could potentially have a $6,700 out-of-pocket cost for a Medicare Advantage plan. Yes, I'm not paying premiums, but also I know that if I go and get something major done, I could potentially have a $6,700 bill. So that's a big difference there. Also, am I restricted to doctors and networks? So the answer is yes and no. So Medicare Advantage plan, original Medicare, you don't have restrictions if the doctor accepts Medicare and it's a medically necessary procedure, then it would most likely be covered, absolutely. Medicare Advantage plan, you have to go through some hoops of doctors. You got to make sure they're in network to get covered. If they're out of network, there could be even a higher out-of-pocket cost. So that's something to consider too. If you love your doctor and they don't accept a Medicare Advantage plan, they're not networked, that may not be a good fit for you. We'll look at those options. And then ultimately, can your plan drop by your doctor? Medicare, no. With a Medicare Advantage plan, the answer is yes. Can it be canceled? With Medicare, original Medicare and supplement, no. If it is a MA plan, if they decided to leave that area or drop that plan, absolutely. But the good news is you'll get a window to switch different companies if you wanted to, if they cancel the plan on you. And then lastly, what if you travel out of the country? Do I have coverage? Original Medicare does not cover international travel. If you have a supplement for emergency issues, yes, you have some coverage. Medicare Advantage plans typically have zero coverage. So, some options there. So that's really kind of a good comprehensive view of a Medicare supplement plan versus a Medicare Advantage plan. Pretty cool there. All right, so here's the key though. What's the right fit for you, right? Everyone's different. Example is my father has a Plan G and my mother has a Medicare Advantage plan, and there's reasons why they do that. So we'll kind of talk a little bit more about that. All right, so let's talk briefly about Part D, prescription drug plans. One of the advantages with the Medicare Advantage plan, Part D plan, is you keep it separate. And so for instance, you might have the husband that's on a certain amount of medications, if not zero. He may be on one Medicare Part D plan, prescription drug plan, and then the wife, the spouse, might be on another plan. So the individual plan, there is some power there that you can sign up based on the prescriptions you're on. Now, prescription drug coverage, it might also include the flu shot and things like that if you get it administered at the pharmacy. So pretty cool stuff there. All right, so there's two options. Again, two options. You can do standalone. I get original Medicare, I get a supplement if I choose, and a standalone prescription drug plan. Or you can also sign up for a Medicare Advantage plan with a built-in prescription drug plan that's also included. Can't have both. You can have one or the other. All right, let's talk about prescription drug coverages, because there are 4 different phases of Part D. Phase number 1 is the deductible. So it's up to $445 deductible for your initial phase. Then you get into what they call the second phase, which is basically up to $4,100, so $4,130. And then you have something called the donut hole. You may have heard of the donut hole or the coverage gap. That's from $4,130 to $6,550. That is a section there is when you pay closer to 25% of the cost of your prescriptions. And then eventually, some people hit that in the month of March. I've seen some people hit that in the month of February. But once you hit that, basically that magic number of $6,550, then you go into what they call the catastrophic coverage phase, which at the bottom there you'll see you either pay up to 5% of the cost or $3.70 or $9 for what they call generic or preferred brand. So the idea there is they try to limit your costs, but also it depends on what drugs you're on, what prescription drugs you're on that help get that coverage. Easiest tool that I ever have used, which is amazing, is going directly to Medicare.gov. They have a plan finder, so we help you with that. You just type in your medications, and then based on your zip code, it will make recommendations based on your current medications and what's the best plan for you cost-wise. It's a great tool. When we visit one-on-one or over the phone or Zoom, I will do that for you, a list of your medications. It takes us less than 5 minutes. It's very easy, and Medicare has a great tool resource for that on Medicare.gov. Great. Let's talk about enrollment and important dates and more. So now, who's eligible for Medicare? Really kind of 2 categories for Medicare. Usually when you turn 65, you are eligible for Medicare. You have a certain window that we'll talk about in a moment. If you're on disability and it's been 24 months, on the 25th month, no matter what your age is, you are eligible for Medicare. And there's a few other circumstances too. But most people sign up around 65 or when they retire, over 65. Now, I want to highlight a few things here. If you're receiving Social Security benefits or Railroad Retirement Board benefits, you're automatically enrolled. They'll send you the card. Now, pause here for a moment. Don't throw this card away. I don't know how many people call me and tell me, I didn't know that was my Medicare card. So if you see this in the mail and you have this digits here and A and B and your name's on it, that is actually your Medicare card. It comes in about a 8x10 envelope, and it just perforated on the right corner. So when you get that card, that's important not to throw it away. Now, you have a certain initial enrollment period. So when you turn 65, you actually have a 7-month window. You have 3 months before your birthday, then you have the birthday month, and 3 months after. So that's a special window that you want to enroll and also look at the options of Medicare supplements or a Medicare Advantage plan. That's an important timing window that we need to know. Let's say, for instance, you're 65, but say, Josh, I want to work till I'm 67. Well, you may enroll in maybe Part A only, and then continue coverage through your work, and then ultimately down the road, when you do retire, you may turn on Part B and look at the other options. You and I, that's a simple conversation. You and I should have a conversation, sit down, or a Zoom visit. We'll talk about your individual window, make sure we plan it correctly. Okay? Good. Okay, that talked about the initial enrollment period. I mentioned that a little bit. 3 months before your birthday, 65th birthday, the month of, and 3 months after. So that gives us what we call the initial enrollment period. All right, so there's really 3 categories that we kind of put into enrollment period. We have the open enrollment. Think of when I first turn on Part B, you actually have a 6-month window. And that's guaranteed issue. This is important to know because no matter what your health history is, so whether you have some major health concerns or health history, you cannot be denied during open enrollment. You can enroll in any plan that's available through Medicare guidelines, right, through the rules. Number 2 is very popular. So think of special enrollment period. Okay, Josh, I am 65, but I want to continue to work till I'm 67. I love what I do. I'm getting paid very well. It doesn't feel like work. It feels like a hobby. So great. When you decide to retire at 67, then that is also considered another special enrollment period. One, you'll avoid a penalty. That's an important thing. I haven't mentioned that yet. There is a penalty. If you're eligible for Medicare and you don't sign up in that window, you could potentially incur a penalty. We'll talk more about that during the 200 level course. And then also just to clarify, you're also guaranteed issue, meaning no health questions, you're guaranteed to jump on any company. Now the third category that I would show you is called outside the enrollment period. So think of that as maybe I'm 68 years old and I've already had Medicare and I have a supplement plan, but I just want to shop around and get a better deal. That's quite all right. I love saving people money by shopping around at any age. Well, ultimately what you have to do is just answer some health questions. So it's some yes and no, you give them permission, HIPAA form to look at your health history, and then once that goes through underwriting, if approved, then you would have coverage. So that's really kind of a key here. If there's some major health concerns, we need to have this conversation up front, so we're on the first and second option where you're guaranteed issue, opposed to waiting outside the enrollment period and potentially getting denied because you're outside of that enrollment period in your health questions. All right, that's easy. Give me a call, we'll talk about it. All right, let's talk about open enrollment. So open enrollment is a key window between October 15th and December 7th when you have the option to switch either your Medicare Advantage plan or your prescription drug plan. So that's a beautiful window and you want to shop that. We help you with that. So gosh, you may be on the same prescriptions, but gosh, prescription drug costs change almost every day. They change all the time, and then the plan coverages change. So you definitely want to shop your prescription drug every year during open enrollment. If you're on a Medicare Advantage plan, you want to look at that too. And then a supplement side, a Plan G or different plans that are options, you also can shop the rates and see if that makes sense for you. So we'll look at those issues. Now with the Medicare supplement, there isn't any open or unopened enrollment period. You can actually shop and change any time of the year. That's pretty cool options, but you may have to go through health history questions or underwriting. So we'll talk about that. Next, we want to talk about the annual disenrollment period. So this gives you another window between January 1st and March 31st. If you're on a Medicare Advantage plan and you're not happy with the service or the network or you just want to switch, you have an option to go back to original Medicare during that 3-month window. So pretty cool there also. A couple resources here that I want to finish with. Number 1 is Medicare.gov. They have a great book called the Medicare New Handbook. If you're having trouble with that, let me know. I'll send you a link to it. It's very easy. It's a PDF. It tells you a lot of options. It's a little dense. It's about 130 pages, but it's great. It's a great resource for you. If you have any questions, I can definitely send you the link to it. It's just great. Another great resource through Medicare is choosing a Medicare gap policy. So think of a Medicare supplement. It goes through your options, talks about how standardized it is, and just really kind of maps it out. Again, call me, I'll give you a free copy of that. I have many copies here in my office. Also, I can send it to you digitally, but ultimately, it's best for us to connect. Let's look at your window, right? Let's look at your options. We explored that today. Let's also look at the cost, and then look at what's the best fit for you. We walk through that, it's completely free, no obligation, consultation there, if you will, and so we'd love to sit down with you and really help plan your healthcare needs. And I say thank you for your time and attending our workshop today. I hope you guys stay safe. Spring and summer is right around the corner. I hope you guys have a great rest of the day. And thank you for joining us today with this webinar. It has been my pleasure, and I look forward to helping you with your Medicare needs or any other financial needs that you have in the future. Thank you, and see ya. And this is the magic button.